This is Antonio Egas Moniz, a Portuguese neurologist responsible for the infamous medical procedure known as the lobotomy. Nowadays is one of the pioneers of probably the worst thing in human history. Moniz was actually viewed quite differently by the world during the conception and application of this procedure. In fact, actually close to winning a Nobel Prize prior to the one he actually won, as he was trying to figure out a non-invasive method of diagnosing tumors in the brain. This concept was called cerebral angiography. Cerebral for relating to the brain, angiography, which is a type of X-ray to check blood vessels. By injecting a 25% sodium iodide solution into the carotid artery of a patient's neck, it would flow up and into the different regions of the brain and present itself in a very unique manner. Unlike previous attempts at brain imaging, the sodium iodide solution was resistant to electromagnetic radiation, so when X-rays were taken, the blood was very visible thanks to them becoming opaque in the image. This allowed doctors to find problems in the brain's vasculature caused by tumors and obstructions in a much more direct manner. In addition to this, Moniz was actually very interested in finding solutions to other illnesses relating to the brain, stating that mental disorders were merely a fixation of synapses, which were expressed as predominant obsessive ideas in mentally ill people. So, in August of 1935, Moniz attended the Second International Neurological Congress in London, and it was here that John Fulton, a neuroscientist from Yale, presented two chimpanzees with reduced or attenuated frustration behavior after a frontal lobe lobotomy procedure. Fulton's chimps had lesions in the frontal areas of their brains, had issues with neurosis, and needed to be progressively retrained. However, after a bilateral lobotomy was done, they became less aggressive and showed absence of temper tantrums. Inspired by Fulton's work and the calming effect of the technique that was presented, Moniz began to perform prefrontal lobotomies in human subjects just months after attending the symposium. Of course, Moniz didn't know which cerebral synapses were responsible for the malfunction. Based on Fulton's work on chimps and his own medical expertise, he proposed a procedure that would sever the connection between the thalamus and the frontal cortex, by surgically excising the white matter of the brain, which he believed to be the culprit. The thalamus is the relay station of your brain. So when your body experiences a sense, it's sent here for processing before being shipped off to your cerebral cortex for interpretation. This then connects through the white matter of your brain to the frontal lobe, which is responsible for reasoning, judgment, creativity, all of the stuff that makes us humans human. So, in 1935, with the assistance of neurosurgeon Pedro Almeida Lima, Moniz conducted the inaugural lobotomy on a 63-year-old female patient who was afflicted with a multitude of psychiatric disorders culminating in psychosis. And using what looks like something you'd find in your dad's tool shed, a patient would be put on their side, and this metal tool would then start drilling a burr hole where the parietal bone meets the frontal bone of the skull to access the white matter part of the brain. Once inside, absolute alcohol would then be flushed into the frontal cortex of the brain to render these white matter fibers offline, completing the absolutely horrendous procedure. And the operation worked. The patient stopped displaying the symptoms of the aforementioned psychosis, and even 2 months after this leucotomy, a psychiatrist who had examined this woman stated that there was a noticeable decline in her ailing symptoms and deemed this case a success. Moniz would then perform 20 lobotomies in total, with the subsequent 19 procedures having promising results. 7 cases having patients who healed, 6 patients who were unchanged, and 7 patients who saw notable improvements. And it wasn't just the people who were seeing improvements. The procedure itself also evolved over time, with Moniz eventually introducing the use of leucotomes, which are specialized surgical instruments designed for performing lobotomies, allowing for the more effective severance of white matter tracts within the brain. And this was the horrible reality of addressing mental illness in those days, as the standard for medical evidence substantiating the efficacy and safety of lobotomies was much less rigorous than any modern benchmarks. During that period, the presentation of a mere photographic juxtaposition of a before and after was deemed sufficient to the notion that lobotomies were an effective means of addressing most mental illness cases. And as a consequence, although some patients appeared outwardly presentable, they were often rendered devoid of emotion and essentially stripped of their humanity. Many individuals who underwent this procedure were physically alive and ostensibly cured of the mental illnesses that led them to seek treatment, emerged as mere shadows of their former selves. They became essentially zombie-like, lacking the emotional depth and range that once made them human. And the popularity of the lobotomy, or leucotomy as he called it, caught on, particularly with a man named Walter Freeman, who coincidentally enough attended the same neurological congress in London. Freeman saw the potential in Moniz's work and thought that the same principles could be simplified and applied to American psychiatric hospitals, where operating rooms, surgeons, and anesthesia were of limiting quantities, and thus in 1946, he performed his first transorbital lobotomy on a 29-year-old housewife named Sally Ionesco at his medical office. And according to Freeman, his version of the lobotomy was a much more effective method, as not only was the procedure done without the use of anesthetics, access to the frontal cortex of the brain can be quite difficult, as the thick layers of the skull surround most of the squishy inner parts. But if we look at the region where the top of the eye socket meets the forehead, this area is rather sparse in terms of bone thickness, and therefore easiest to access the brain cavity. So it was here in this upper region of the eye socket where a long, thin metal pick was pushed in with the aid of a mallet, to not only break through this thin layer of bone, but to access the white matters of the brain. But wait, remember how I mentioned that this procedure was done without anesthesia? Freeman concluded that because this was to be a non-surgical procedure, the use of electroconvulsive therapy was effective enough to subdue the patient long enough for the pick to go in and swish around in the brain. And so in 1949, the Nobel Prize for Medicine and Physiology was awarded to Egas Moniz for pioneering this horrific procedure and providing a bleak teaching moment even 70 years later. But thankfully, the world didn't take too long to realize that this procedure, despite the Nobel Prize, was horrific and widely unsubstantiated, as shortly after the award was given, there was a trend toward more balanced reporting, and articles began to express the need to examine evidence and weigh the pros and cons of the operation, which is a good thing given how lobotomized patients were seen as not too far from human vegetables. The detrimental consequences of a leucotomy are well documented today, but during the 1940s, discussions of its negative side effects were often absent or cursory, with even authors appearing to intentionally downplay the adverse effects, with comments like, "Curiously enough, all three were tormented with a desire to die." As more and more research was conducted, people were starting to catch on to the idea that perhaps this line of treatment wasn't necessarily the most medical appropriate option available, with more subsequent news articles on lobotomies outlining the hilarious lack of medical evidence and positive results in lobotomized individuals. The rise of antipsychotic medications was also starting to gain popularity in the 1950s, as chemical lobotomies, such as the use of chlorpromazine, were deemed much safer options versus the invasive leucotomy and lobotomy procedures that were standard at the time. This, combined with the increasing discomfort among the medical profession and general public regarding lobotomies, led to a sharp decline in the use of this procedure. Thank God.